To unmute myself. Thank you. Thanks for that introduction, Meg. So as Meg said, I am Jessica King. I'm a Research and Evaluation Associate with PHI. Title of my presentation today is Career Lattices and Ladders, Creating Opportunities for Maryland's Direct Care Workforce. So if you haven't heard of us before, PHI is a national nonprofit organization that we're committed to strengthening the direct care workforce through research and evaluation, policy advocacy, and novel workforce interventions. We promote quality direct care jobs as the foundation for quality care. This is a little snapshot of Maryland's direct care workforce with using data gathered from PHI's Workforce Data Center. So this workforce consists of about 51,000 direct care workers. Sorry, just moving things around. 51,000 direct care workers supporting older adults and people with disabilities. This consists of about 25,000 home health and personal care aides and about 26,000 nursing assistants. It's predominantly made up of women of color, women and people of color, and about 40% are immigrants. It's an economically precarious workforce with median annual earnings of only about $27,000 or about $16.38 per hour. Because of this, 40% of Maryland's direct care workforce rely on some form of public assistance. There's also disproportionate rates of occupational injury and comparatively poor health status and care access among the workforce. As indicated in the statistics I just shared, direct care workers fill an essential role, yet face persistently poor job quality. In turn, the LTSS sector is facing a recruitment and retention crisis. At PHI, we've developed an evidence-based framework for improving job quality called the 5 pillars, shown here. What this framework shows is that job quality is multifaceted, and so too are the solutions to the workforce crisis. Today, we're going to focus on the pillar of real opportunity, which means that a quality job has the opportunity for professional growth and personal fulfillment. Career lattices allow direct care workers to move between care settings and transfer their skills and credentials without having to go back through training or start back at square one. Oftentimes, direct care workers find that when they move between settings, they have to start their training all over again. And this can prevent them from quickly stepping into other paying roles. This adds to the workforce crisis because there's not a ready legion of trained direct care workers when more might be needed in a specific environment. The idea of a universal worker is such that a direct care worker's credentials to work across settings. By having a universal worker credential, it tells an employer that they have been trained a specific way and have applicable direct care knowledge. Career ladders allow workers to move up in their careers, which can help with retention as workers have the ability to grow their skills, be recognized for their achievements, and get paid more. There are a few examples of career ladders listed here, such as New Jersey's DSP career advancement law that has created a pipeline in career advancement opportunities for direct support professionals. There's also the Moving Forward Coalition, which is a nationwide effort that's in exploratory phases of the best way to design the apprenticeship model, wherein CNAs can be trained and credentialed while earning higher pay for each stage of training that they complete. California has implemented this with a CNA RAP program that's currently underway, and their first cohort of apprentices started training in early 2023, and they're just completing their training now and getting credentialed. In Massachusetts, the proposed PHCAS model would allow personal care aides to move from PCA then to LPN and RN. This pathway provides certification and additional certification as you earn more training. There are then different course options for further training, depending on if one is new to direct care, has experience in the field, or even if they're a family caregiver and have that experience. However, it's important to acknowledge that not all workers may want to have increasing responsibility or manage people, or they do not want to become LPNs or RNs, which is why career lattices are important to provide more options and opportunities for them. This example is an example of a career lattice in Wisconsin. The Wisconsin Department of Health Services has partnered with the University of Wisconsin-Green Bay to create a credential known as the Certified Direct Care Professional. It's geared towards HCBS workers, and it consists of a free online training followed by a certification test. Workers then sign on with a worker registry that allows them to connect with employer agencies, and they can then earn a $500 sign-on bonus if they work with one of 364 participating employer agencies. The intention of this certification is to build a career pathway to more advanced care and nursing positions. But even if a worker does not want to pursue a more advanced care position, they have the credentials that they can easily move between those employer agencies, as I mentioned. So at PHI, our workforce innovations team created this curriculum for an advanced role for home care workers known as the Care Integration Senior Aide. PHI offers training to organizations to implement this role among their home care workers who want to take on more responsibility, earn higher pay, and exhibit their care expertise to improve care outcomes, which can lead to more cost savings overall for home care agencies that employ them. And then another career ladder example is the Quality Improvement in Long-Term Services and Supports, or QUILTS program. This program is based on a person-centered care delivery model, and it allows workers to earn 12 different badges by taking competency-based online courses to enhance their skills. Those who participate in the program can earn higher wages from Tennessee's Medicaid program, and it also is part of Tennessee's Workforce Initiative Toolkit, which helps DSPs in particular with their career pathways. This is a matrix of what the career pathway could look like if one pursues this career and participates in the training program. And then there's just one piece of legislation I wanted to highlight, and this is a proposed piece of legislation that is currently in DC's legislature. And DC City Council introduced the Direct Care Worker Amendment Act this past November. This bill increases the portability and transferability of credentials by creating one credential for both home health aides and CNAs. It also allows those who have been certified as home health aides or CNAs in Maryland or Virginia to work in DC. And it would require the mayor to create a direct care worker apprenticeship program. And some other components of the bill that don't directly relate to ladders or lattices are lowering the age requirements for direct care workers to 16 years old. So if a direct care worker is participating in direct care worker training program in high school and they happen to graduate before they're 18, this would allow them to get a job before the age of 18 as a direct care worker if they've completed that training. And it also establishes a minimum wage for direct care workers as 120% of DC's annual living wage. And this is important because by indexing this minimum wage to the annual living wage, it will be adjusted automatically year to year to keep up with inflation. There's also some other bills pending in Maryland's legislature that would benefit direct care workers, but not directly related to ladders and lattices. And there are fact sheets available for these bills from Carrying Across Maryland. Thanks so much. And that completes my presentation for today. And I'm really looking forward to having a great discussion about this.
Thank you, Jessica, very much. That was an excellent overview. I appreciate it. So next is Sharon Ward, who is the Earn Youth Program Manager for the Baltimore Alliance for Careers in Healthcare.
And good morning, everyone. And so I am coming today from a very unique lens from Baltimore Alliance from Careers to Healthcare, or better known as BAC. We are a workforce intermediary, and we were founded to provide the healthcare industry training opportunities for the underserved and unemployed residents in Baltimore. Primarily, we service the female population, as well as the African American or Black community, with that being, both of those being over 90% in our demographics. We do this through partnerships because we do not provide any direct services. And so with that, we partner with the Baltimore area hospitals and healthcare facilities, community organizations that provide some wraparound services, and also some of the case management, and of course with our training providers that are the community colleges. BAC provides, as far as direct care workers, we approximately train 100 CNA, GNAs annually. And so with that, we get to have a very close look and develop a very close relationship with our CNA and GNA communities. who comes to us primarily is our sitters, and our home health aides, and then those, of course, who are looking to start their pathway in the healthcare spaces. When we talk about lattices from what we see from the Bach lens is that a lot of the folks in the personal aid, home health aid spaces are not looking to advance their career by way of title. They're looking to stay in those spaces in which they are, to gain additional skills, as well as to make themselves more profitable, and earn, be able to earn extra for the credentials in which they have acquired. Within that, one of the issues, if I may, that it presents itself is that the respect, if you will, of the credential is often not recognized within those spaces. It's a benefit to the employer, but oftentimes not a direct benefit to the employee from the stance of being compensated or being able to be recognized for the additional credentials and their improvement to the workplace. When we talk about those who are starting their CNA, GNA journey as a pathway into other areas, we have a lot of folks who are coming into these spaces, and this is their first time even approaching any healthcare career. This is their first time having any formal education or training outside of what they've experienced since post-graduation and those kinds of things. So as an adult learner, these are some of the challenges that they do have. They could have been, 15, 20 years outside of a classroom environment and those kinds of things. However, they have the opportunity, with the support of what we do, to sit in those spaces to learn. They're highly motivated, but they're often getting into these spaces. And as we follow them as direct care workers to some of our funding opportunities, as we follow them, the feedback that we're receiving is that the CNA, GNA position is not highly respected, that they are often not heard, that they're, of course, often overutilized and in ways that are contrary to their the direct training and credentialing that they have received. This has been a direct link that we have seen to the issues that come from the employer lens, which is retention. So the retention issues are, as those that I've already identified, are plaguing the industry and causing the high turnover rate and those kinds of things for the direct care workers. A lot of times people focus on the barriers being things like the money, they're not getting paid enough and those kinds of things. But interestingly enough, as I have surveyed the CNAs that have completed the training, it is a factor, but it's not their primary factor in deciding to either leave the industry or to leave that particular role. And so one of the things that comes up repeatedly is the respect of the position, the role, and the credential. Oftentimes they're looked down on and not seen as a vital team, a part of the team, which causes, poor job quality and all of those things. So one of the areas that we're looking at working with our partners to try to see how we can overcome that is through the social competencies. And so Bach is looking to determine through our partnerships how it is that our partners can provide training in the workplace for those employers who are like nurse managers and things like that, who are working directly, have CNA and GNAs working directly under them, to provide some kind of social competency training, of course, diversity and equity training and those kinds of things, so that we can have an open forum of discussion amongst the two different groups and their perspectives, and determine some real outcomes, and hopefully be able to start to change the trajectory of things such as retention, respect, and a respect also of their talent. Oftentimes the feedback we have is that, of course, they come, and being that they're so up close and personal with the patients, when they take feedback to the higher ups, if you will, to their managers and such, that their voice is not heard and not respected. And again, what we have seen, especially post-COVID, is that people are more likely to leave a job for things such as not being respected, not being heard, and those kinds of things. It's, for whatever reasons, it's very easy to, or maybe not easy, but it's common for them to walk away from these spaces, and to make other choices in terms of their careers and their pathways. And then, without being redundant, but the pay, of course, is another issue. Not sure how that can be tackled other than just continue to shine the light on it. Just from a perspective of a real life story, I have a participant who went through the CNA GNA training, who has been in the space for more than 5 years and is making $15.38 an hour. This probably changed now since Maryland law. And she mentioned to me that her son got a job at Chick-fil-A and was making $16.10. Of course, he's a student, not a full-time. However, it was very disheartening for her, as a licensed healthcare professional, to realize that in terms of compensation, that her role still falls so short on the totem pole of equity when we're talking about pay. And so that is something that industry-wide, of course, needs to be addressed. And it is a true barrier, because when we're looking at who the demographic is, we're looking at, where they're coming from, being an underserved population, and those kinds of things. There's a great impact financially, to be able to raise a family. How do you pay for childcare? All of those things. And so they create great barriers that make a huge impact into whether or not people continue on in these spaces as direct care workers. And so thank you very much for listening. And I am too excited about the conversation to engage.
Thank you. Thank you so much, Sharon. I'm glad you brought up respect and appreciation. We are actually going to have our next webinar on that topic in March, so stay tuned for that. And also, I think what David Rodwin, our vice chair of our board, noted in here in DC, that that legislation that Jessica, you had mentioned, would bring the minimum wage, and DC, I think, has the highest minimum wage in the country, or one of the highest, I believe, would bring that up to $20.46 an hour for those who are working DC. In Maryland, the minimum wage was just brought up to $15 an hour as of January 1st, which I believe is not nearly, is not close to being a living wage, especially in the Baltimore area for most folks. So I don't think it meets any living wage calculator or gauge, actually, in the Baltimore area, at least, and probably a lot of Maryland. So thank you, Sharon. And so up next, we have Fahim Karim, who is regional coordinator with Employ Prince George's. Welcome.
Thank you, Meg, and hello, everyone. It's a pleasure to be here with all of you. I work as a regional coordinator for Employer Prince George's. Employer Prince George's is the primary or the principal workforce agency for Prince George's County. And our the workforce agency is considered one of the trailblazers in the workforce space, mainly because of how we approach in the whole business of helping people who are seeking jobs. One of the ways we have looked at the population of the people that we're looking to serve is we have 4 different categories. One is students who are in high school or were looking to graduate. The second is the incumbent workers, for example, people who are already working in different offices and different industries, and they're looking to either upgrade their skill sets, mainly because they're making lower wage and they have the potential to make higher wages. The third is the non-traditional workers. So this could be your veterans, it could be the immigrants, as well as those who are 50 plus, as well as the returning citizens. And so we want to make sure we address their unique needs of that non-traditional workers. And lastly, the traditional unemployed population. The other thing, what we realize is that in Prince George's County, I can speak for ourselves, is that we have quite a bit of youth that are leaving the public school system even before graduating. So we have like close to 4,000 young people that graduate, that leave the school every year simply because they don't see how their education is going to actually help them, make a decent earning and have a good career. So the way we wanted to address it is that, like the saying goes, if you keep doing the same thing, you're going to keep getting the same results, right? And so we partnered with an organization called CALE, which is the Council of Adult Education and Learning. And we wanted to bring all the employers from different industries, in this case, the healthcare space, and we asked them, you tell us what are the people you're looking to hire, what are some of the things that they need to have for the different positions that you are looking to hire in the healthcare space, because that's what we want to find out, because that's what's going to make those workers attracted to you so that you will hire them. And so we try to reverse engineer. And so we created a beautiful career pathway document, which hopefully you get to see it. And that what we try to do is make it very easy for people to visualize. So if somebody wants to become a home health aide or a community health worker or a social worker or a pharmacy technician or a registered nurse, we have it entirely mapped out. So the person can see, okay, I'm at point A. If I want to get to point Z, what are the steps do I have to do or do I have to take? On top of that, what we've done is we have reached out to various education partners and training providers and said to them, look, these are the needs of our community. We want people to help become registered nurse. We want to help them become scribes. Can you provide those trainings to us? And some of them, they stepped up and they have registered with us as local training providers. Believe it or not, we offer scholarships to 300 plus courses through Employer Prince George's, and many of them are geared towards healthcare. So for example, if somebody wants to pursue nursing, somebody wants to become a scribe, the list goes on. So what we try to do is when we have somebody, maybe an existing incumbent worker working in a healthcare space, and they're looking to earn a higher wages, as Sharon had beautifully pointed out, because that is a big challenge, that minimum wage of $15, and sometimes they don't know how to get to that to the next level. So what we try to do is we have a career counselor that works with that person, and we try to find out what is the need. Is it the person cannot get a job, or is the person is able to get a job, but they're just not able to secure it, or do they want to move up laterally or in lattices, right? So based on that, that's when we provide different recommendations, and we also offer them those free trainings. At the same time, we know just giving trainings is not sufficient, right? People have a lot of barriers. They have childcare needs, their cars break down, managing finances, all of these are barriers. So we also have a thing called supportive services, so that, for example, somebody while going to training, their car breaks down, we offer Uber rides. If they need a new set of uniform to start their job, we offer that. I know there's a lot of wraparound services that comes with it. And so I'm really proud of the work that we do. In my role, what I do is I work with businesses, whether they're large hospitals, healthcare facilities, or small business owners, and I try to find out what their business needs are. And then we try to help them in fulfilling those needs, whether it's hiring more people, creating job recruitment events, or also connecting them with resources and partners that's going to help them reach those business needs that they have. So I'm going to stop there, and I'm going to look forward to the Q&A session. So honored to be here with all of you and learning so many amazing things. And please look forward to your Q&A soon. Thank you.
Thank you so much, Fahim. That was really very interesting and helpful. Thank you. So Joshua Harrold is up next. He's Regional Director of the 1199 SEIU Training and Employment Fund in Maryland and DC. Thanks, Joshua.
Thanks a lot, Meg. Thank you. Let me get my screen shared here. Hold on one sec. You guys are seeing it okay? Okay, great. So as Meg said, I'm Joshua Harrold. I'm the Maryland DC Regional Director of 1199 SEIU Training and Employment Fund. The Training and Employment Fund's mission is to promote career pathways for healthcare workers by developing quality education, skills enhancement training, job placement, and innovative worker-employer initiatives to create a world-class workforce that meets the demands of an evolving healthcare industry. There's no question that career ladders and lattices are effective ways to train and retain quality staff. I believe one reason these ladders and lattices fit so well in healthcare is because it's an industry that possesses stackable credentials. There are clear career pathways for individuals to follow that can ultimately lead to family-sustaining wages. An individual can start their healthcare career at several different entry points. Many of these are roles considered clinical in nature, like a home health aide working in patients' homes, or a nursing assistant working in a long-term care facility, or for a hospital system. These entry points are very accessible because they may only require a high school diploma and a short certification course. Once established in these, and Lori, you'll like this, in these first line positions, career seekers can take additional training or enroll at a post-secondary institution to become a patient care tech, licensed practical nurse, or a registered nurse. I'd like to dive further into a topic that we at 1199 SEIU Training and Employment Fund discuss with both our career seekers and our management partners, and that's the idea of a good job. On January 18th of last year, USDOL issued the Training and Employment Guidance Letter, or TEGL 722. As part of this guidance letter, the U.S. Departments of Commerce and Labor jointly identified 8 key principles of a good job: equitable recruitment and hiring, benefits, diversity, equity, inclusion, and accessibility, empowerment and representation, job security and working conditions, organizational culture, pay, and skills and advancement.
Joshua, I'm sorry to interrupt you, but if you're advancing your slides, I'm still seeing the first one.
Oh my goodness. Okay.
FYI, so.
Yeah, I was advancing my slides. Let's, you know what, I'll just talk. It's fine. So those 8 principles that I just mentioned can be further divided into 3 different buckets. The first bucket, job necessities, which include adequate wages, job security, and safe working conditions, diversity, equity, inclusion, and accessibility and benefits. The second bucket, career supports, include recruitment and hiring, and skills and career advancement. And the last bucket is worker empowerment, comprised of worker voice and organizational culture. Good jobs are the foundation of an equitable economy. They lift workers and families, at the same time making businesses more competitive. By improving the quality of job opportunities, workers are provided the ability to achieve economic stability and mobility, while also prioritizing diversity and worker voice. These traits are foundations of the organized labor movement and a major mission of the 1199 SEIU Training and Employment Fund. Now I'd like to take the time to promote a program that we're currently operating. Actually would like to point out that 2 attendees, Ricara Jones and David Rodwin, were played an integral part in getting this program going. And I believe this is a program that many attending will find interest in, and it's the Baltimore City Direct Care Worker Pandemic Relief Benefit, Thanks to Mayor Brandon Scott, this program, in partnership with 1199 SEIU, United Healthcare Workers East Union, the Training and Employment Fund, and the Mayor's Office of Recovery, is providing a $500 benefit to Baltimore City direct care workers that continue to provide services to their patients during the height of the COVID-19 global pandemic. To be eligible for the program, individuals need to be Baltimore City residents who worked as home health aides, patient care associates, certified or geriatric nursing assistants, or LPNs, for a minimum of 6 weeks between March 1st, 2020 and August 31st, 2022. Their employer must be on the Maryland list of approved home care agencies or skilled nursing centers. And I think someone just put it in the chat, but interested individuals can get more information and apply for the benefit at baltimorecovidbenefit.org. So that's baltimorecovidbenefit.org. This program has already provided us with insight on direct care workers' desire for upskilling. Of the 1,789 individuals that have completed an application, 742 have expressed interest in enrolling in one or more training programs. 188 of those are interested in workplace skills workshops. 356 expressed an interest in enrolling in a post-secondary degree program, and 524 wish to engage in an occupational certification. This reinforces the economic mobility opportunities via stackable credentials for healthcare workers, but also shows us that when asked if they're interested in pursuing advancement training opportunities, many direct care workers answer yes. Thank you very much.
This is good to know, Josh, right? I hadn't realized it had opened, so that's excellent. How many did you say have expressed interest? You said out of
700, so 742 out of 1,789. So it's like 42%.
Wow, that's incredible.
Yeah, Lori, and I knew you would like that too, based on our conversations, before this. Yes.
Thank you so much, Joshua. So up next is Jennifer Kraft Morgan, who is Director of and Professor in the Gerontology Institute at Georgia State University. Welcome, Jennifer.
It shouldn't be so hard to unmute. I'm sorry. Good afternoon. It's nice to be here with you. Instead of spending my entire time talking about all of the different evidence that has accumulated to support career ladders, I wanted to talk about the things that we need to do in order for career ladders to be feasible. And since this is such an applied audience, I really wanted to have this be the way that we sort of start off the conversation and support a conversation on how we really build career ladders and lattices. So I think it's really important to think about and recognize the really important contributions that all of the other speakers have made already in terms of thinking about a shift in mindset in this industry, where we're recognizing, listening to, respecting, collaborating with, providing safe environments for, including, lifting up, and empowering these workers. Direct service workers, direct care workers, CNAs, home care aides, assisted living aides, all of these first line workers, as Lori likes to call them, these workers are all in the same, if you talk to them, they're all in the same workforce. They jump in and out of sectors that we put into silos based on the way that it's funded by the federal government, or it's regulated by the state governments, or thought about as employers. But these workers just come to work in order to give good care, to make a big difference, care a lot. In the research, it's clear that they're intrinsically motivated, that most of their job security, job satisfaction derives from their intrinsic motivations, right? They want to take care of people. They want to give to their community. They want to respect their elders. They want to support people living with disabilities. They want to do all these things that require meaningful and engaging relationships with their clients. And that's where they get the juice from, right? That's what they get happy about. And those relationships and the feedback from those relationships is why many of these largely women of color are in this job and care about this job and are motivated. And therefore, the stuff that Sharon was talking about earlier really makes sense, right? Because they want to be respected for this really important role that they play in the health and social care system. It's not just about healthcare. It's about supporting people to have quality lives, right? To have good quality lives where we can actually live into our older ages, or we can live with disabilities. We can have a good life. We can enjoy our simple pleasures. We can move forward together as families and friends and colleagues in a way that supports the community. So it's not just supporting clients, which a lot of focus is on, right? Older adults and people with disabilities, or patients, if we're talking about the acute care setting, but lifting up these workers who are part of that community and part of their communities are really essential, have so many essential roles. They have so many essential roles in servicing the communities that they come from. They have lots of unpaid care roles at the same time as they have paid care roles, and they have multiple paid care roles at the same time they have multiple unpaid care roles. And the devaluation that this workforce gets because of those overlapping layers of vulnerability, right? Or women, or people of color, they're often immigrants. They're essential to their communities. They're pulled in many different directions, and they need more from the system. That's the workforce system, that's the employer system, that's the regulation system, that's the way that we think about employment generally. They need more. And it's our job, I think, as the many stakeholders that are on this group, is to figure out how we support those workers to acknowledge the skills that they have. We know that workers in this workforce do not increase their wages over 10 years of working in the same job. I mean, it's minimal or reduction in wages, 10 years working in the same job, getting better at it every day, taking care of people better every day, getting to know people, to make meaningful relationships with people, helping people who are having difficulties get to their simple pleasures and have quality of life. This meaningful work is not remunerated over time. So, I can go to a job where I know that there's no career advancement possibility. I can work in that a little bit of time and then I can leave it, right? But if you're a worker in this field, you don't see any future for yourself. And the reason that I've spent a lot of time and thought about career lattices and career ladders is because if we could make it meaningful, and that it's actually tied to advancement, real professional advancement, not just $1 an hour from one point to another, but real professional advancement. And we could tie those things together from the employer side and the educational partnership side, then we could make a huge difference in professionalizing and empowering these people who need to be creative, need to be problem solvers, and have, one of the most essential jobs in the world, right? So what do we need out of career ladders? We need...
I'm sorry to interrupt, but if
Sure.
you had your slides, oh, there you go. I'm sorry, I wasn't sure.
I wasn't advancing my slides yet. I am now advancing my slides. This is me. I'm at Georgia State. There's my email if you'd like to get in touch with me. I think that career lattices are important, right? You all talked a little bit about career lattices, and what we need out of career lattices is we need to know, as an employee coming into an organization or an employee coming into a sector, how do we get up? How do we get across? And how do we get to where we want to go? And we don't always want to go into nursing. They don't always want to go into laterally into something else. Sometimes they want to continue in the job that they're doing and get better at that job, right? So we need lattices that support that sort of advancement. And it needs to be absolutely transparent so that when somebody comes into an organization, they can mark out their path and they know exactly how to get there. That isn't the case in most collaborations. It's really confusing. It's not accessible. It's not transparent. The encouraging employers to advance the career lattice, they need to be acquiring the education training that they need. Many of these workers languish in education and training. They get education and training because they want it. and it doesn't lead to anything. We've pushed employability back on our workers. They're in charge of improving their skill sets. And as employers and as systems of education, we are not scaffolding that in a way that leads to better jobs. It needs to lead to extrinsically better jobs in order for it to be meaningful. If we don't have that scaffolding, there's no chance that all that education leads to anything. And then you've got people who are disenchanted, disenfranchised, and have done all of this important work, invested in their own education, and don't have anything materially to show for it. It also means that employers and employees have to have internal hiring practices where their employees are grounded and groomed for higher level positions, right? It's not just a system point of view, but it's an employer themselves have to figure out how it is that you're going to groom your internal folks for these higher level positions. In most of long-term care, it's a very rigid hierarchy. We've got all the direct support and services people at the bottom. We've got we've got nursing between them, and we've got management and a layer ahead. And there's very few ways to get through that easily for workers who start and stay with long-term care organizations. These opportunities to gain the credentials and degrees have to be associated with internal and external career advancement. That has to be, you want to be an employer of choice in your community, you have access to these, they articulate with other employers or collaboratives. I mean, that's one of the great things about Bach is that they've got all of these people, all of these different stakeholders at the same table, trying to build these career lattices among those collaboratives in one city. That it makes it very thoughtful about how you associate that education, that credentialing, that professionalization to actual meaningful career advancement that's transferable and stackable and accessible. I mean, Fahim talked about this. Josh talked about this. The accessibility is so important. It has to be at some level work-based so that people can get to it easily, that they have tuition support, whether it's not tuition remission. Tuition remission in this population does not work. You cannot ask people to lay out the dollars and get those dollars back. You have to do a tuition remission possibility for them. You have to be able to support them somehow through a training fund or otherwise. And then create those career maps, right? That have the competency-based job tiers, the educational opportunities that support them, and are clear and transparent. And we still have not succeeded that in very many places in long-term care specifically. And those career maps help both the new workers and the incumbent workers understand the pathways to get that increased responsibility, increased compensation. And as Sharon pointed out, it's really important that you can move your way up within a type of position. That over time, when you're gaining skills and you're getting better at your job, you get recognized and rewarded for those jobs. It's not just because I go from direct care to engagement or dementia care specialist or something else. I'm in direct care. I'm good at direct care. I have an ability to move into a medium level position in direct care and then an advanced level position in direct care. And I can be a peer mentor, and I can be a supervisor, and I can be a support person. All of the things that can happen. I can be a preceptor. All of those things that can happen in those advanced roles are really key. And then partnerships, as Bach has shown and others have shown, partnerships with employers that are in different sectors in one area often can do these pipelines. And of course, we need governmental and pay reform support to really make this accessible to lots of different employers, right? And I think while the employer of choice thing that employers really can make a difference here, it has to be in partnership with education and workforce investment and unions and others in order apprenticeship models, whatever it happens to be that the vehicle is, it needs to be in partnership, and employers have to recognize it with compensation. Yes, these people are intrinsically motivated to do this work, and yes, We need to reframe it so that we understand, do the recognizing, the listening to, the respecting, the collaborating, the providing for safety, the increasing inclusion, lifting up and empowering these workers, all those really important intrinsic things. But if we don't solve the extrinsic side, the pay, the real benefits, the real pensions, the real access to the kinds of benefits that you all on this call have, or most of you do, then we're not professionalizing that workforce, and that's what we need to be able to do in order for them to continue to stabilize. Is what we need. It's for stabilizing the whole sector. We have lots of videos. This is from one of the videos. These slides were from one of the videos on expanding career opportunities, but we have lots of micro learning videos that are really short that can be helpful in terms of increasing and extrinsic rewards within employers. And that's at our YouTube channel at Culture Change Network of Georgia. Thanks.
Thank you very much, Jennifer. So we're going to open it up to questions. If you could either put it in the chat, that would be great, your questions. And while we're doing that, I would like to ask, because Sharon has to probably run soon, I'm going to ask Sharon, if you don't mind, thinking about what Jennifer's description of the map, the importance of creating maps. Bach works in partnership with employers. Do you have any or help them implement these sorts of maps, or do you have those sorts of things in place? And if you could describe how that works with Bach.
So yes, we do have career maps that are available to all of our participants, and is
we may have lost her. Oh no. Well, if she's able to get back on, let's see, Lori, do you have, I'm curious to know if you have something to say about
some of that. You know it. First off, I want to say it's very, very cool you're all here. It's very, very cool what you've all done. I've spent 29 years here at NACA running a professional association of and for CNAs. I feel like I've met over 100,000 CNAs in my career, and I started as one in 1980. The sad thing is I've not seen a lot of good change for CNAs since 1980, and I've spent 29 years at the helm leading them. And so everything you're saying is absolutely spot on. And if I could wave a magic wand right now with this crowd, I would say that please be mindful that people that are credentialed with a C, as in certified, do not appreciate being referred to as workers. We don't call the president a government worker. We call them the president. And titles are important to these people who are working their tails off with little reward or recognition. And for us to be successful at everything you stand for and what these programs are about are amazing. But until we get employers to pay attention, we set a lot of people up for failure. So much is placed on management, and in the nursing home world, administrator DON turnover is at the highest it's ever been, and it's always been high. So people that want leaders to be different need to be looking at how do we help the first line independent of their employer. There's nursing things, there's doctor things, there's everybody else's things that have zero attachment to their employers. Why must CNAs? They've been put in a box. They call it task talent. We all know the staffing ratio fight is pretty hot and heavy. And we know that it's a difficult topic to talk about. But the things are, what has happened recently, I was speaking with an administrator who said, we don't need more staff. I said, how do you know? Take the two things that are the biggest off the table. It's going to cost you some money, and we're 400,000 CNAs short today in this nation. And he said, well, here's how I can tell you we don't need more help. Every afternoon when I go down there, there are 4 of them sitting at the nurse's station on their phones saying they're done. I said, they are done. He said, no, they're not. I said, they certainly are. They're done with every task that was on their sheet. Nobody ever writes, Bessie seems a little depressed today. Spend 20 extra minutes with her. Bessie is a toilet, a turn, a sheet, a bed, a wheelchair, whatever it is that she has is what Bessie is. She's not Bessie. And so we have trapped these individuals, these wonderful, talented professionals. Nursing homes are required to have compliance. CNAs have been trapped into that too. They think all CNAs need are those 12 hours the feds mandate every year. And those are, if I've worked for you for 15 years and you have me go take my Relias Death and Dying, it's the same course I've taken for 15 years. You are not investing in me. You are trying to be in compliance. So think of CNAs and your direct care professionals as task talent. That's what they have been pigeoned into. And it's going to take a lot for employers to ever let them branch out. It really is. There's fear there. There's a lot of fear in letting someone else train and develop your people, because the employer can no longer tell what is told. They can't. And so for somebody that's been doing this for 29 years, trying to professionalize nursing assistants, certified nursing assistants, and not done a bad job at it in 29 years, every single failure we have had has been at the employer site for not recognizing. I have members that take incontinence specialist certification. It's not recognized. They're not going to get a dime more for it. But in 2019, 75,000 hours of non-mandated education was taken by my members who had no incentive whatsoever to do so. So CNAs do want to learn, and they are right for it. When I started the association coming out of operations, I thought the hardest people on earth to motivate would be CNAs, and the easiest would be the employers. Boy, was I wrong. No employer wants their CNA really to be a part of our organization, because then they have that voice Jennifer was talking about. And the stuff Sharon presented, I couldn't have done it better myself. There is no respect in this country for CNAs. They do not know you and I exist, that are sitting here fighting for them every day. They only know what they see on the ground. And so every day there's articles in the paper. I know I get them, the news feeds of CNAs that report findings all the time that are never followed up on by more people that are higher in the chain than they are. And the last thing I'll say again is just how incredible positive I think this webinar has been from those of you who are taking real action in the DC, Maryland area. The state, the rest of the nation should follow you. And I guess that wasn't the last thing. Here's the last thing. At the onset of the pandemic, some of you probably don't know who I am, but I was fortunate enough to sit on the White House Coronavirus Commission for Quality and Safety in Nursing Homes. It became clear that there was not going to be any real change within the 3rd week of our meetings. Part of the problem is in this nation is there's no good, let me back up. Every state has a deficiency in the amount of CNAs they need because of the bureaucracy at the state levels. It took 8 months for us to get 3 of our last students in our online NICE, the National Institute of CNA Excellence. All those months to get 3 students through a state bureaucracy. They timed out of testing. before we could get them through. There are things that are in our state mechanisms that are prohibitive for us to scale a care force. I would ask you to start using care force instead of workforce. I even got Secretary Becerra using it, and AMDA uses it constantly. We need to build a care force, something these individuals can believe in. And some of you know about this, but Sharon sparked this in me. We created 3 years ago a new best practice called the Enclave Principle, and it is setting up distinct CNA departments with CNAs as the leaders. There's a DNA, a director nursing assistant. There's 6 to 12 certified preceptors, our CNAs who do all of the onboarding and training at these buildings. And I'm going to tell you, it is checking off all the right bells. CNAs are cocked and primed to lead, and the only way we're going to sustain this is if we free them from being just under their employer in order to grow where they're planted. So thank you all, and great workshop.
Thanks, Lori. Does anybody have any comments, questions? I actually did not see any questions in the chat, but raise your hand if you want to add something. I think, Joshua, you said that you actually put something in the chat. The training fund is working to develop ways. I'm sorry if you could.
That's okay. Yeah. So I know that the one thing was talking about institutional racism, I believe. And I mean, it's definitely a topic that the training fund, we talk about workforce shortages all the time, but we're also pairing that up with occupational segregation, right? I mean, everyone's talked about it, that the percentage of workers that are women of color and immigrants working in the CNA GNA positions, in the home health aide positions, is far outweighs the numbers that are in leadership positions. That, I mean, and Lori just did it. I mean, that's really interesting to have a director of nursing assistant, right? To give that power where it needs to be, right? Where they can their voice can be heard. They can make the decisions that affect those workers, those individuals doing that work. So looking at that, and I will say one thing, that I put some goals together for 2024 for Maryland, DC. And one of the goals is to increase our tuition assistance. We have a scholarship program for our union members to increase the number of long-term care workers by 30% that apply for that, because I see that as definitely one way for our long-term care workers to be able to advance and get into more family sustaining wages if they're interested in pursuing degrees.
Thank you, Josh. That was very helpful. And that's interesting to know. Katie Lemke wrote, we are working on care lattices here in Arizona, breaking down the perception the care profession is a dead end job and making the career lattice accessible. I think that's incredible. And she really appreciates the focus on bringing education to the industry. I think that's amazing. Anybody else have any questions? All right. Well, thank you so much, everybody. It is exactly 1 o'clock. And I think Sharon had to go. So she came back on and she pasted that information in the link. And I really appreciate everyone joining us today. This was really very interesting. We are recording this, and we will send everybody a recording along with as many links that we can get. Fahim, I would really like to get a link to you had held up a document, and if we can get a link to that, that would be great. And
Sure,
again,
we'll do, Meg. I'll send you a copy. Thank you.
Thank you very much. We'd like to share it with everyone. So thank you so much, everyone. Have a good afternoon.
Thank you.